Good evening. Rebecca from the Chilton Public Library here. Over the course of the last few months, we have received questions as to how we are gathering our data in regards to the COVID numbers in our service area. Those are numbers that we report back to our Chilton Public Library Board of Trustees, and we wanted to take the opportunity to show the community how they can gather that information as well. It is all publicly available information that we use, and what we do is I'm going to open a new tab here. We just go to the Calumet County Public Health Department website. So we're going to go ahead and we're going to click on that. You can use any browser that you want to be able to access that information. And as we scroll down here, we can see that there is a public health area that addresses COVID specifically. So we're going to click here for the COVID-19 information. And the Calumet County Public Health Department has a lot of information that can help you answer a lot of questions that you might have in regards to local data, contact tracing information, the Calumet County test sites, as well as prevention and some of the symptoms that if you wanted to look to see if those would be COVID-related symptoms. For the use of the library, we go ahead and we go to the local COVID-19 data tab. And as that pulls up there, it opens up a page that gives the Facebook page for the Calumet County Public Health. And now this information is going to cover the jurisdiction of the Calumet County Public Health. That does not include the city of Menasha or the city of Appleton in any of these numbers. Both of those jurisdictions have their own public health departments. And so when Calumet County puts out their numbers, it excludes any cases or deaths or hospitalizations that fall within the city of Menasha or the city of Appleton. One of the first dashboards that we go and we use is we go to the local dashboard. And I'm going to click on the desktop version of it. However, the mobile version of it will give you the exact same information that you're looking for. It is going to open a new tab for you. And this dashboard is updated daily with the exception of weekends and holidays. And as you can see, there is a lot of information on this page. The Chilton Public Library, when we are looking at COVID-19 data in our service area, we look at what is the total confirmed cases within the county's public health jurisdiction. This is going to be a number that generally should not change. It may change if there was a problem in the testing, and then they do report if they have to make adjustments to that. But this number will always go up. This is just a cumulative number from the time that they started tracking COVID-19 to the current date. And as we can see, this is today, November 17th. So currently, the Calumet County Public Health Jurisdiction has had 2,851 total confirmed cases. We also look at the number of active cases. Now, this is a number that will fluctuate. It will go up and it will go down as people recover or new cases are added on to the county. We also look at the total number of deaths, and once again, that is within the Calumet County health jurisdiction. And then we also look at the current hospitalization. That kind of gives us a little idea as to how the hospitals are being able to handle the cases within our service area. If you wanted to look more in depth in here, you can also see that the Calumet County Health Department does break down by age group the number of total cases. They also break down cases by gender. So you could take a look if you wanted some of that additional information. That is information that we generally don't use though when we're reporting to the library board. So I'm going to go ahead and close that tab, and we're back to the Calumet County Health Department COVID page. Then there are two additional sites that we look at. We go to the Wisconsin Department of Health, which the Calumet County Health Department does provide both links on their website. And we're going to look at cases by census tract. And then we're also going to look at case rates, trajectory, and virus activity level. So I'm going to go ahead and I'm first going to go and look at the case rates, trajectory, and the virus activity level. So I'm going to click on that link, and once again, it's going to open up a brand new tab for me. And this is going to give us the opportunity to look at the activity level by the region and the counties. So as I scroll down, we have two options. We can look at the disease activity and we can look at hospital capacity. And we're actually going to look at both of those. So we're going to start with disease activity. When we click on that, it's going to open up. And as I scroll down, I'm going to wait for the data window to finish opening up. We can see the entire state of Wisconsin, the COVID-19 disease activity rate. And it's going to give us the case activity, the percent positive, the COVID-like illness activity, as well as the influenza-like illness activity. You can see that they do color code them, and if you let your mouse just hover over them, it will give you the date range that this information is being compiled from. So we can see that this is going to cover the 2 weeks of October 28th through November 10th. And currently in the state of Wisconsin, we're at a critically high level for case activity, a high level for percent positive, as well as COVID-like illness activity, but we are at a low level of influenza-like illness activity. If we scroll down just a little bit more, we can see some additional data. We see the entire state, and we can actually hover over each county on there, and it gives us some additional information. So if I go to Calumet County here, we can see that it does state that Calumet County is at a critically high burden of 1,225.8 cases per 100,000 people, and that the trajectory is not showing any changes in the cases. So it's not rapidly increasing, but it is not shrinking either. We can also see that the information is provided down below as well, that we can see in a quick view the activity level, the burden, the trajectory, and then the number of cases over time on that. So we can also, if we didn't want to hover over on the county, if we come here to the left sidebar, we can actually select which county we would like to look at. So I'm going to go down to Calumet, and I'm going to click on that. And it's just going to then change the information that is below the state map to give me the Calumet County data. And so we can see all that data right there without having to go through that map there. If we scroll down a little bit lower, we have the option to be able to see how the state comes up with the information to provide to the website. So for instance, if we wanted to see how they measure case activity, we can open that up and we can see all the information in regards to how they confirm a case and whatnot. It also will give us what is considered the burden status on there. So we can see that, if we scroll back up, that we are currently at a critically high burden level. And we can see here that critically high is a case rate that is higher than 100, or I'm sorry, higher than 1,000 cases per 100,000 residents. And it breaks it down for each level of that. And it does the same for trajectory as well as case activity. And so we can go ahead and we can see all that information that is provided by the state And we can look, we could go through more. Let me just scroll back up so I can close that. So for each one that you wanted to look at, you could see how do they measure COVID-19 like illnesses. And you'd be able to read through and see what their explanations are for that. And so those are some of the data that we look at in regards to the activity level. We also can scroll back up and we can look at the hospital capacity level to see what our local hospitals are at. Now, this particular site will not break down by specific hospital. It will break it down by regions. So we can see right now, it is always going to default to the state of Wisconsin. So we can see in the state of Wisconsin as a whole, 88.9% of hospital beds are in use right now, and 90.6 of ICU beds are being used. We can then go and once again in that left sidebar, click on the select area, and we are in the Fox Valley area. And we could see that because we could go to the map here. And if we hover over where Calumet County is, we can see it tells us right here that we are in the Fox Valley region area. And it does say that there's no significant change in patient hospitalizations. But if we wanted a little more detail, we could go ahead and we could select Fox Valley. And it will pull it up. It will once again show us the comparison of Wisconsin to Fox Valley area. And it will also at the bottom show us how the hospitals in the Fox Valley area are doing. So right now we see that hospital beds are at 93.0% use and ICU beds are at 89.3% use. That is not the only data though that we look at. So I'm going to go ahead and I'm going to close this tab and we're going to go back to the Calumet County Health Department jurisdiction. And we are going to take a look at the cases by census. Once again, it's going to open a new tab for us. And this is where information can be broken down into county level, and we actually can narrow it down a little lower than that as well. So I'm going to scroll down just a little bit, and we can see here where we can jump to specific charts on this page. And the one that we use is the the number of cases by county and census. So I'm going to go ahead and I'm going to jump down to that, and it's going to take us to a map of Wisconsin. And it does give us a legend to show us how the colors correlate as to how many number of cases are in each county. But we're going to close that because we're not going to need that right now. If we go ahead and we actually click on Calumet County, it is going to give us a little pop-up box that shows us Calumet County and the number of positive cases. Once again, that's going to be a number that will always increase or hopefully eventually not change at all. This is due to the fact that this is just a cumulative number from the start of COVID to the end of when reporting will be. We can see how many people tested negative, as well as the number of cases who have died. Now, this number will differ from the Calumet County Health Department jurisdiction number. That is because this number will cover all of Calumet County and not just the health department's jurisdiction. So this number will include the sections of Calumet County that include the city of Appleton and the city of Menasha. So do not be surprised when these numbers on this particular pop-up do not match the Calumet County Health Department's jurisdiction. We can also see the total population of the county. And what we do at the library is we're going to zoom in and we're going to look at the census areas that are provided. And this will take us deeper into the county boundaries. I'm going to go ahead and I'm going to close up this little pop-up box just so we can see where that they have outlined the different census areas of the county. And so when we are looking at the information, we are looking at what we consider our service area. So we consider our service area the City of Chilton, Town of Chilton census area, the Brothertown Stockbridge area, the Hilbert Potter Stockbridge area, And then we also have the New Holstein area, and that is because we tend to overlap with the New Holstein Public Library as well in regards to those service areas. This allows us to be able to take a look at a more narrowed down version of the numbers that the Calumet County Health Department jurisdiction puts out. So the first one that I'm going to look at, I know the city of Chilton is right in this area. And now if I wanted to, I could go ahead in this plus and minus, and I could actually zoom in further into the map, and I can actually see where the cities are located. I'm going to zoom back out just for the purposes of this video so that you can see the different areas. So I'm going to click on the 1, and this tells us which track number it is. And I can tell that while it doesn't tell me what areas it actually covers, if I zoom in, I can see here that the city of Chilton is here. I know that the town of Chilton is around here. So that is how we've determined that. So when we talk about the number of cases in the city of Chilton, town of Chilton census area, this is that area that we are talking about. So if I click on it, it once again opens up a pop-up box, and it will tell me the number of positive cases, once again, a cumulative number. As of today, November 17th, it is 422 cases that are covering the population of 4,905 people in that census area. It also will give me the number of cases that have died in that census area as well on there. They will not report anything that is under 4 cases. So we don't have, right, we have less than 5 cases so far of deaths within that particular census area. If I click onto our next area, and I know I can see that this is where Stockbridge is. And it is census tract 204. I can see that there is 201 cases. If I click here, where here is Hilbert and here is the village of Potter, it will give me tract 202 with 322 cases. And then if I click down here into the New Holstein area, I can see that there are 335 cases in that area as well. And once again, it gives us the total population of that census area, as well as when it was last updated, the number of negative results as well. And so what we do is we go ahead and we actually input that information into our own spreadsheet daily, so we can see a daily increase of cases or a steadying of cases if that is the case as well. And that is how we access some of the data that we are looking at that we present to the library board that helps us make some of the decisions in regards to our services that we're offering currently right now due to COVID-19. I hope that you found this video informative, that it gave you a few extra tools to help you get the information that is being provided by both the health departments in both the county and the state. This helps give us a better view as to what's going on than just taking just a county number that's being reported in the news. We're able to narrow down and make some more decisions. On top of the Calumet County, we do look at the other counties that are surrounding us as well. If you have any questions, please feel free to give the library a call at any time, and we can certainly do our best to help walk you through some of this information as well. I hope you all have a wonderful day and evening, and please stay safe. We look forward to seeing you guys again. Thank you so much.